I have some lipstick I'd be happy to put on.
Go ahead.
Well, thanks everyone for attending. My name's Tim Fowler. I work for a company called Tucker Johnson & Smelzer. We're the medical broker for your folks, for your health insurance. You actually purchase your health insurance through the TPE, the Purchasing Edge. It gives you a little bit better pricing that we can receive from the insurance carrier. I'm going to go through and talk about what happened with the renewal this year. The original renewal term that we received from Highmark came in at 9%. We made some plan design changes that I will go through as far as the deductible and the health reimbursement account. So we made a plan design change. The final renewal is coming in at 7.6%. We're going to talk about the health reimbursement account change and then to go over the premium cost before we turn it over to Bridget, who's going to talk to you from MetLife. First off, how many people here have paid attention to the UPMC, Highmark, all the advertisement that you're seeing? Anybody at all? How concerned? Somewhat, none. Each of you should have received a letter last Thursday in the mail from Highmark, since you're currently insured with Highmark, trying to reassure you that all of the changes that are going on, all the discussion that's going on in the media, that you will still have hospital coverage through July through June 30th, 2013. What has gone on is Highmark will no longer have a contract with the UPMC owned hospitals effective June 30th of 2012. Now the coverage that you're being asked to renew is going to be through September 1st, 2012. So there's a couple months there you're saying, geez, am I going to be able to use the UPMC hospitals? If my physician is a UPMC owned physician, am I going to have coverage there? The Highmark's position is that you will. Their contract expires June 30th of 2012. But there's a 1 year extension that says we will have coverage through June 30th, 2013. UPMC has said, okay, we are terminating that contract, and we own 2,800 UPMC physicians. They are employees of UPMC. Highmark says of those 2,800, 2/3 of them are paid for by the hospital. So if they are actually employees of the hospital, they will still be under contract with Highmark for that additional year. That will be decided in the courts because it's very clear. UPMC says it's this way, Highmark says it's this way, and so the courts will have to make that decision as far as those 2,800 physicians. The biggest issue is that Highmark's contract is up for renewal. They don't want to negotiate for a number of reasons. First off, Highmark said they wanted too much money. They wanted a 20% increase on their non-Medicare business, which is about a $400 million cost increase. If they increase that cost, your premium rates go up. It's that simple. When Highmark takes a look at a group and says, here's the premium they paid us last year, here's the claims that we paid, if the price goes up 20%, your hospital costs will go up 20%, hence your insurance premium would go up 20%. So they were negotiating that on the price, and then Highmark then entered the fray and said, okay, we're going to help save West Penn Allegheny, which is a competing hospital system to that of UPMC. So they've invested $50 million and they have committed another $400 million to have that vying organization. And that was when UPMC said, okay, we are absolutely not even going to talk to you about it now, because now you're in direct competition not only with our health insurance, UPMC health plan, but the UPMC hospital network as well. And so again, it will be an interesting time to find out what will happen a year from now. I'm here to reassure you that your insurance carrier has said no problem. That was what the letter that you received last week said. Don't worry about it. You're going to have coverage through at least through June 30th, 2013. But I can also show you a letter that UPMC sent out that said that's not the case. So again, that will be, yes?
Where are the doctors affiliated with McGee Women's Hospital? Where are they out of?
Well, some of them are not owned by UPMC. Some are individual and have admitting practices at probably 4 or 5 different hospitals. So you actually have to find out if yours is actually owned by UPMC, your specific physician. McGee also has, its contract is not up. I think it's good for another 5 years, and Children's is good for another 10, or I may have that reversed. So
Children's with UPMC?
Yes, but when they signed that, when UPMC was allowed to take over Children's Hospital, there was a side agreement that said, that they will be independent for a 20-year time frame, because people look at Children's Hospital, McGee Women's Hospital, and there'll be a lot of discussion about the Hillman Cancer Center, saying those are publicly publicly funded entities. There's been a lot of dollars that have been paid. There's a lot of fundraising that says that's a community asset and they shouldn't own it. All right. So any other questions on that? So again, you're going to continue to see the biggest winners of this are going to be the advertisers, the TV guys. You know, John, what's Pompiani's first? Bob Pompiani. Now he's the spokesman for West Penn Allegheny. You're going to hear more advertisements. We've heard UPMC advertisements for many years. So it's going to be a lot of back and forth. And again, all I can tell you is to stay tuned. I can tell you what one carrier says and what the other. And at the end of the day, we don't know what will happen. So I'll go ahead and go through the plan design. In your packet is the benefit grid. It is essentially the same benefits that you had last year. However, a change was made on the deductible. Last year you had a $1,500 deductible. You will now have a $3,000 deductible individual and $6,000 family. Now, that's the actual deductible from the insurance carrier. But that will be paid for. Part of that will be paid for by the health reimbursement account. The prime PCP, the $20 per visit, is still going to be the same. The specialist, the urgent care centers at $25, the same as they were last year. Emergency room visit $50. The deductibles and copayment do not apply on preventive care. We do have a list over there of what actually is on the Highmark preventive schedule that will be covered at no copay. But again, the biggest change is going under the deductible, going to the $3,000, $6,000. Under the drug program, retail drugs, 31 days, 60 or 90-day supply. The co-payments are listed there, either 8, 16, or 24. For generic, for formulary brand, those that are on the Highmark list, the co-pays are 40, 80, and 120. And then if you're going to a non-formulary brand prescription, that's going to be 55, 110, and 165. So again, you really want to pay attention to that when you go to the physician and you say, okay, the physician certainly knows what's on the Highmark formulary. You also can request a generic substitute to make if there's one available. You also can inform your doctor about if you're going to, depending on the medication, if it's an antibiotic, you can go to Giant Eagle. Actually, we receive those for free, or there's a lot of $4 prescriptions as well. If you are on any type of maintenance medication, birth control, blood pressure, cholesterol, strongly encourage you to use the mail order that's listed down below. You will save yourself 4 copays a year. So if you're taking the same prescription month in, month out, there's information in your packet to do it. You need to call your physician, have your physician give you a 90-day prescription with 3 or 4 refills, depending on when you saw that physician last.
Who is the mail-in person?
Pardon me?
Who is the mail-in?
It's Medics, but it's in the process of they've been sold. I think to Caremark, but I'm not sure on that. So again, the information is in there. You want to do that. So by doing that, you fill out the paperwork one time. When it's time for a refill, you can have them give you a phone call. You can go online and reorder it. They can have you send you an email, and they will again pay for it. You can pay for it either by check or you can pay for it credit card. Again, that's the best way that if you're on any type of maintenance medication that you should be doing that. Again, you'll save your copays doing so. Common benefit where the deductible will apply. Okay, so you go to the doctor's office and you say, I want to have a physical. They do height, weight. As soon as if they find something that's not going to be covered under the preventive schedule, they say, okay, Tim, you're out of weight. You're overweight. You're in your 50s. We want to do a colonoscopy, or we want to do a stress test. In those situations, that's when the deductible would apply. Inpatient, outpatient services, ambulance, diagnostic services. That'd be your MRI, your CAT scan, PET scan, standard imaging, X-rays, those types of things, all subject to the deductible. Home health care, therapy services. Again, same as last year. Yes.
Is that the $3,000 deductible?
That's correct.
So if I were to go to the doctor's and he requests a colonoscopy, I have to pay for the full thing?
Well, I'm trying to get to you have a health reimbursement account under the HRA. You will pay 50% of every bill. So you will pay $1,500. Okay. The total deductible from Highmark is $3,000. You will pay 50% of that amount with A Advantage paying the other 50%. So if you go and have a colonoscopy, the billed charge is $1,200. The covered charge is $900. The negotiated rate. You would be responsible for $450, and the carrier and A Advantage through the HRA would pay the $450. Okay, different than last year when you paid first and then they paid. So all the expenses now will be split 50-50. Okay, so health reimbursement accounts, it's an account funded by your employer, helps to pay your out-of-pocket expenses. Integrated with your health plan, which means that under the old HRAs, you received the explanation and benefit, you had to fill out the paperwork and receive reimbursement. Now Highmark pays it, they send it over to the other side under the health reimbursement account. Under the HRA, then they will pay the provider directly. You will receive an explanation of benefit. We'll go through that here in a second. But it allows you to monitor and check your health claims online. So here we go. Reimburses deductible expenses in and out of network. Up to $1,500 is what your health reimbursement account will pay per individual. $3,000 per family. You actually split each claim 50-50. So let's say you had a $100 charge. The covered expense is $80. They're going to pay $40. You're going to pay $40. How will you know how much you owe? Okay, I'm going to jump ahead of myself there. How are claims submitted to the HRA? The member sees the provider. You give them your ID card. Go see your doctor. Give them your ID card. They submit the claim to Highmark. Highmark processes the claim. The claim is automatically sent over to the HRA side of your plan for payment. The HRA account balance is reviewed to ensure the funds are there, and make sure you still have funds available there. Funds are then pulled from the HRA account, because that's an employer-funded and employer-owned dollars, different than an HSA that you had a number of years ago. The provider receives the payment, and you receive an explanation of benefit that says, okay, here's what we paid, and you'll receive another thing that says, here's what you should be paying. And we have examples of those. So again, it's done, yes?
Can you make payments on that?
Can you put money into the HRA, or can you make payments to the provider?
If you get a bill, if there's a bill that comes to me, can you make payments on the bill if it's high?
Yes. Yeah, I think most medical providers, as long as you respond at all, that says, okay, you'll get the first 30 days, not a problem. 60 days, you need to at least call them so they have it in there that said, hey, patient called, they're going to pay us, send us $20 or $40, and as long as you do that every 30 days, you keep your account active, most medical providers are not going to turn you over for collections. When you ignore that, that's when you say, geez, I'm getting credit done and things like that. As long as you acknowledge that you owe the dollars and you try to make some form of payment to them, you should be in good shape. It is up to the individual medical provider, though, but most hospitals. So this is the explanation of benefit. This is the Highmark portion that says, okay, I had a $100 procedure. It goes through your list of data service. It says, okay, here's the provider charge. Here's what's been approved for payment. Here's how much Highmark through the insurance company is paying. Oh, it's an $80 charge. You have not met your deductible yet this year. It says patient responsibility, $80. It then gets kicked over to the HRA. Then you receive an explanation of payment under this form, and this one will say, okay, there's an $80 charge. We're paying $40. You as the employee owe the other $40. I can't stress enough, never pay a doctor or anybody any money until you know exactly what the insurance carrier has paid. The best way of going on is to go online, highmarkbcbs.com. You log on there. This is the screen. It is much easier in the past. You used to have to log on. They would send you your PIN number. On here, you go down to the manager plan down below, the bottom right. You set yourself up. You go in, you complete the information here. You can either use your Social Security number or your member ID off the insurance card to complete this information. They will then actually send you your PIN number right then and there. You can either have them send you an email, they can send you a text message to your phone, or they can leave you a voice message or call you back on your phone to say, okay, here's what your PIN number is. Can't stress that enough. You need to go on and have that done if you're using the medical plan at all. Tells you how you want to be notified: voice, email, text message. And then you can go on and you will be able to go on their website and you'll be able to look at every explanation of benefit that you had for the last 2 years. Okay, so you get a data service for a doctor that says, hey, on April 15th, this service was done and you owe us $38. Unless you have a form in here that says, hey, the patient's responsibility is $38, you should not be paying that. Again, this walks you through the website, tells you how much money you've paid, how much has gone towards your deductible, but it gives you an active account of what you've done, what you've actually spent under the health insurance, and what you owe the various providers. Again, all listed on there. Claim activity goes back. You can see it goes back 2 years if you've been covered under the program.